Buongiorno a tutti, very welcome to this plenary. This is the third day of the summer school. This morning we have the pleasure to have here three people in online. So, can I go on with the slides? Or this is a single slide? Yeah, it's blocked. So, welcome to this very special day. Today is 31st Independence Day of Ukraine. Everyone here knows very well what's going on. We proceed with our life, business as usual, but the business is not usual. By chance, 31st Independence Day, like the Lugano Summer School, but these are very different things. I don't want to spend any word on it. I just want to say that the war in Ukraine, of course, represents a turning point in the international relations, in international economy, but above all, a disaster for millions of individuals, or millions of families. So, sorry for saying it. A true disaster for millions of people that are really hit in their normal life. This morning we will have a plenary that, let's say, has this awful background as a general picture, but then we have always to find something positive in life experiences. And so we were talking about, this is the title, Building Resilience through Healthcare Financing Reforms, Lesson Learned from Ukraine. Yeah, healthcare services have to go ahead. This morning there are diabetes, there are cancers that have to be treated. Many people need services. And so we will see in the next presentations what's going on and how health policy is going on to assure the possibility for the health system to go. We have the pleasure to have three speakers this morning. The first speaker, I think that the order will be with Nataliia Riabtseva, then Pavlo Kovtoniuk, and finally Richardson. As you can see on the internet page, Nataliia Riabtseva, she's a co-founder of the Ukraine Healthcare Center, which is an independent health policy think tank based in Kiev. There, she leads the management education stream. She also served as advisor to the Ministry of Health for her country and as the deputy head at the National Health Service in Ukraine. Pavlo Kovtoniuk, he also is a co-founder of this Ukraine Healthcare Center. He served as Deputy Minister of Health of Ukraine and worked as a consultant for instance, also the WHO office in Barcelona. Of course, the Ukraine Healthcare Center is deeply involved nowadays in the war experience, but it was also involved in COVID-19, in providing analytics, providing policy advice. Nowadays, one of the focus is in the documentation of attacks to health facilities all over the country and health personnel. Erika Richardson, she's technical officer. It's very important for Europe, this institution, the European Observatory on Health Systems and Policies, that helps us to understand how systems function. Her work focuses on the development of health system and the policy in Eastern Europe, the South Caucasus, and Central Asia. She edits health system reviews, so the descriptions of the systems for many countries in this region, as well as covering developments in her, I think, home country, that is United Kingdom. Well, so we have, let's say, not so much time. We have 3 speakers for 1 hour. I asked them to be short, if it is possible, and I, with pleasure, leave the floor to Nataliia Riabtseva. I stop here, and she will take the control, or we have to have, okay.
Yes.
Thank you, Nataliia. Up to you.
Good morning, everybody, and happy Independence Day of Ukraine to all the Ukrainians who are today in Lugano and who joined online. My name is Nataliia Riabtseva, and I'm co-founder of Ukrainian Healthcare Center, an independent think tank which is based in Kiev. Today, we will talk about resilience and how much it is crucial for the health system ability to respond to the crisis. We will start from the parallel between the Ukrainian army and Ukrainian healthcare system. And this is not accidentally, but not because of the ongoing war, but because of the history of reforming these 2 spheres in Ukraine. And next, I will describe the essence of health financing reform in Ukraine and what it has to deal with resilience. Further, my colleagues Pavlo, Kovtoniuk and Richardson will step in, and so we will have a really intensive and interesting session today in the morning. But first, let's look at the Ukraine, the country. I'm wondering how many of you have been in Ukraine, of course, except of Ukrainian participants. But what is important to know for today's session is that first, Ukraine is #1 in terms of territory in Europe. So it's really large country with quite some number of population. And I believe that many of you could imagine what it means in terms of doing reform in the country in any sphere, not only in health. Also, Ukraine, since its independence in 1991, was a peaceful country, obviously with lots of challenges in different spheres, but the 2014 has changed a lot for the country and the nation. In 2014, we had the Revolution of Dignity, and that was the first case in our peaceful country when the civilian protesters were killed by the state security services. And further on, we also faced the annexation of Crimea and the start of war in the Donbass, which is the eastern part of our country. That was done by Russian forces. But another important point is that despite all these challenges and some other economic and social challenges that year, the government of Ukraine has proceeded with major system reforms in different spheres, and in particular in the army and the health care. Why do I want to mention the reform in army, which actually aimed to turn to the NATO standards? Well, I believe you all heard about the ongoing war, but also you probably read about the original prognosis that Ukraine won't be able to defend itself in case of Russian aggression, and that it will be captured in just several days, because Russia is much, much more bigger, has a continuous experience of aggression towards other countries, and so-called second army in the world. But the reform still was ongoing in Ukraine, and it actually appeared that if you start the reform in advance, and if you have a systemic approach to renew your army, you could actually get prepared for even such crisis and survive. If you look at the map of the world, you could see and certainly recognize now that Ukraine is this quite small yellow part compared to Russia. And our army was able within several years to build the resilience and oppose already for half of the year to the open aggression of the Russia. But what about the health financing reform, which is quite often so unpopular in many countries because of its difficulties and quite often not easy decisions? In Ukraine, we have actually faced all typical challenges related to the promotion of the reform idea and its execution. The implementation of reform started in 2019, and at first it demanded the adoption of new law. And obviously, we have faced the opposition from the parliament. We had strong discussion in the government and lots of communication attacks on our team. I could actually talk for hours about this reform because, as was already said, I was the project manager of the reform team, led at that time by the Deputy Minister Pavlo, whom you will hear soon. And later on in 2019, I actually did what I didn't plan at all. I became the deputy head of NHS Ukraine, the newly established single payer in the health system. You could certainly find various technical reforms about technical reports about health financing reform in Ukraine, but I would say that from our personal perspective, that was incredible and a bit crazy time when we actually lived within the reform, and sometimes we even wonder how we survived through it. That was the magic probably of our personal resilience, I would say. But we have been very motivated because with the health financing reform, we actually aimed at better financial protection of people who need care. Because in 2016, the national poll showed that 9 out of 10 citizens were afraid of financial hardship in case of their relatives seeking the health care. So for us, the health financing reform was actually an important step on our long way towards the universal health coverage. And if we look at the core of this reform, I would say that we tried to move from a very outdated feudal system, which was totally input-based in terms of financing, to a new system. And this new system, which is here represented by the national logo of National Health Service of Ukraine, included several important developments which were new for the healthcare in Ukraine. First, we have introduced the Institute of a Single Payer. That was the first in the history of independent Ukraine, and thus NHS Ukraine appeared. There was absolutely new governmental body created and made operational within just several months upon the adoption of health financing law. Nobody believed in it, but NHS Ukraine paid to the health providers for the first time within the just 4 months since its formal creation. Second was the development of reform was actually the procedure of direct contracting of health providers. So NHS could contract all the health providers in the country directly without any intermediate structure or body. It is also important to mention that the health providers got much more managerial autonomy in their operation. And that was also for the first time in the history of Ukraine when the government contracted the private providers for the state budget. The third element of the reform was the introduction of new payment mechanisms, which were output-based and introduced the famous in health policy network principle, money follows the patient. Our fourth development was the strong focus on the primary health care system. We have moved, we pushed the system to move from the old hospital-based system to a focus with the primary health, and we also put lots of attention to the reimbursement of priority out-of-patient medicines. And then the fifth element was the e-health. Despite a very strong opposition, we decided that the health providers will have no option to be contracted by NHS Ukraine if they do not operate in the electronic system. So there were lots of very unpopular and difficult decisions for the system, but we were quite proactive and strong in implementing them. And now let's look at the timeline of the reform, both from the perspective of the reform and the wider country perspective. Almost at every stage of the reform, we actually heard that it's not the right time to proceed now with the reform because of the range of reasons. For example, when we started with the first contracting of primary healthcare providers in the mid of 2018, that was the launch of the presidential pre-election campaign, usually not a very good time for big changes in social sphere. In 2019, when we had the first full year of reform at primary healthcare level, and we were actively planning the launch of hospitals contracting since 2020, the government has changed dramatically. We had a new parliament, we had a new government, and we had 3 ministers of health in just several months. Everybody was afraid of the reform and didn't want to adopt the essential legislation. But somehow we have succeeded to proceed with our plan. And in 2020, when the COVID-19 got to Ukraine, we have contracted the hospital network all over the country, despite all the doubts. Obviously, there were much more things to do to finalize the introduction of the new health financing system, but then in 2022, we have faced a full-scale war in the country. And that's actually the first takeaway from this experience and for today's session is that the reform implementation, when you do that, the crisis is not an excuse or good enough argument to stop or postpone the reform. Even vice versa, I would say that crisis is a very good moment as it turns the attention from the reform and allows you to proceed with it without typical negative attention from various groups. But let's look whether the reformed system helped to overcome and survive during the crisis, for the health system. So COVID is the first example. Let's have a look how a new health financing system has responded to it. First, having already 2-year experience of introducing health benefit package, the NHS Ukraine has quickly developed special packages for the COVID-19 and introduced the corresponding payment procedures. Before the reform, we hardly had professionals experienced enough to do that. Second, the NHS Ukraine already had direct contact with all the contracted network of health providers, and it has thousands of different facilities and providers in this network. And the NHS Ukraine was able to both collect and share the essential data and information in a very limited time. Before, it would be done all manually and in a much longer timeline. Third, the NHS Ukraine was able to adjust the payments and the amount of these payments to the providers on a monthly basis, according to the reporting from the providers. In the old system, it would be done quarterly in the best possible situation. But shall we now look at a more difficult crisis, more challenging crisis, the war? Pavlo will provide you with some more details and concepts, and I will underline only some outcomes of the reform on the resilience of the system within the war. Aside from other negative effects, the war has caused the biggest internal and external migration of population from our history, and the health workers as well. It has also adjusted the priorities for the central and local governments, especially at the territories where active military operations were ongoing and are ongoing now. And all that might have played rather unpredictably for the health system financing and service provision. However, and this is remarkable, I believe, the health system not only stands, but it's operational according to the governmental rules. The presence of the NHS Ukraine and direct contracts have ensured that the payments to health providers and to the pharmacies are proceeded. Moreover, the NHS Ukraine was able to adjust the payment mechanisms for different territories. As of now, the NHS Ukraine pays 1/12 of annual budget to those providers who are in the active military operation zone, and it pays based on reporting to all other providers. And this is important as it allows providing care to people at any territory. For instance, in spring, 180% of patients got the care outside of their region of permanent living because of internal migration. Earlier reform efforts have also created a good basis to introduce even some developments during the war. For example, the family doctors got the official right to prescribe the medicines for mental health. Another example is that Academy of NHS Ukraine introduced new online courses for the health professionals to support them during the wartime. In the future, this capacity that has been developed to proceed with the new packages and products and to adjust the payment mechanisms will be very important at the stage of health system renewal after war. And there are still many further ideas and plans to implement, of course. And in fact, the post-war period is a very right time to do that. So the second takeaway for today is that the reformed system is much more resilient in crisis times, and it's even able to further develop during the crisis. And here I pass to Pavlo, but please, I ask you to keep your questions so we could discuss it after all the speeches today. Thank you.
Thank you very much. Hello to everyone. I hope you can see my slides, right? Nice. I will, speaking about resilience, okay, I will concentrate on actually the problem which Ukraine now needs to be resilient against, right? And I will concentrate on the ongoing war and its effect on healthcare in the country. I was well introduced by the moderator today, and just to add to that, and to what Nataliia said, my primary role during the 2016-2019 health reform actually to be the political face of this reform and to be a political leader. Nataliia was more a person making the gears working. But right now, in the last couple of months, I was very busy with very different things. And I was very busy with our project at Ukrainian Healthcare Center about documenting and investigating into attacks on healthcare facilities and health personnel. as potential war crimes. And actually, this is what I was really thinking hard over the last month since April, when I got back to Kyiv from the western part of Ukraine, where I brought my family and started with our team to drive all across the country to visit sites of attacks on hospitals, to first of all get the impression, to document things, to gather testimony, to gather evidence, but also to get the personal impression about what we will need to be resilient against and what we will need to rebuild when the war ends sooner or later. And I have 4 messages to you today, and those are the following. The main message is that the destruction of healthcare in Ukraine, which is happening right now, to me, is not the collateral problem, collateral damage of this war, but is a means of this war. The second message is that the main impact of that is an all-pervasive insecurity, which our people do feel, and that's very difficult actually to talk about and to convey to you, right? It's something very difficult to express. Message number 3 is the main result of this is a human capital catastrophe, not buildings ruined, but people's lives ruined and the losses in people which my country is suffering. And message number 4 is that would be actually our new task for any reform which will go on in Ukraine. That would be all about rebuilding this people's potential and rebuilding human capital. To give you an impression about what happened to healthcare, to reformed healthcare, I would say it was in transition in Ukraine. I can tell you that the healthcare in Ukraine had been a subject to a massive, brutal, and deliberate destruction, and it has witnessed all sorts of attacks against healthcare facilities and health personnel. It has seen what is called in the international humanitarian law as targeted attacks, when Russian troops attack some health facilities because they are health facilities and they knew very well that those are health facilities. For example, in Makariv, near Kyiv, in the district of Bucha, which you probably know from the news, there was a very good primary care center built in 2018 during the health reform. I visited it when I was the Deputy Minister of Health. Primary care was a priority during health reform in our times with Nataliia in the ministry. And in early April, I got to know that this facility was attacked by Russian troops, and I immediately jumped into my car and I visited this place, and I found this. I found that this place was totally obliterated, and this sign saying you can get your vaccine here, because this place was also the center for mass vaccination against COVID, right? It remained, but all the facility was destroyed. We investigated into that case and we found out that it was destroyed on purpose and it was a targeted attack. So the Russian troops used a mortar fire. This is a small anti-infantry cannon, a mortar, and they made 5 attempts to finally target the facility. So they missed 4 times, and then from the 5th time they finally hit the facility. We found the holes of shells all around the place, and even were able to establish a place from where the attack was committed. Similar targeted attack happened in Tenets, Sumy Oblast. It's in the northern part of Ukraine, close to the border with Russia. This town of Tenets, kind of 40,000 population, was occupied. The hospital was operational. It treated patients. And Russians knew very well that this hospital was a hospital and it was operational. By the way, this hospital was a success story of health reform. Again, it was renovated totally in the last 4 years. But on March 23, as Russian troops were retreating, it was attacked with a tank fire. We got a footage on that, and we even were able to identify perpetrators by names. So the tank came in front of this hospital and just shot at it directly with at least 3 shots. And that was done without no military justification. Ukrainian hospitals suffered a lot of indiscriminate attacks, like in Chernihiv on March 3, the residential area in the center of the city was hit by unguided bombs from the plane, and the Chernihiv Cardiac Center was destroyed totally during this attack. You can see it on the screen. The appalling fact about this attack was that it had no military justification at all, no military objects, no military targets. The plane was just flying and dropped 8 unguided bombs on the residential area. 47 people died, and 4 apartment buildings, a pharmacy, and hospital were totally destroyed. We again identified the bombs, the plane, and we know also the name of the perpetrator, and we know very well that this was deliberate and indiscriminate attack on the center of the city. Even more appalling case is the use of cluster munitions. If you don't know about cluster munitions, you're lucky. We unfortunately have to know about that. Cluster munitions are prohibited by international law because cluster munitions are designed precisely to kill as much people indiscriminately as possible. This is a large rocket which is consisted of smaller bomblets which scatter all across the place and then explode, and the shrapnel goes all around the place, killing as much people as possible. This is the remnants of one of these munitions I found in the residential area in Chernihiv region. And on March 17, the regional children's hospitals with kids inside was attacked by cluster munitions, and these small pieces of shrapnel would penetrate more than 200 windows in these hospitals, and they could kill very many people. It was a pure luck that half an hour earlier the air raid siren was there. It was actually ended, the air raid alert was ended, but kids didn't make it to their wards from the basement. They were just, getting out of the basement. They were in the process when this attack came, and all the kids in the hospitals were safe and alive by pure chance. But people in the yard of the hospitals and on surrounding streets were not. And this hospital, children's hospital, was forced to treat adults and to take care of adults who were severely wounded by this cluster munition. And these to the right are the pieces of shrapnel which the hospital director showed us, and they said that those were taken out of the patients actually, which they treated on March 17. If you ask me, okay, why you're saying that healthcare attacks is a means of war? Why don't you think that it was just, the war is bad and people suffer and it happens? I will show you this slide, and you will see that only these numbers can tell you that it's not a coincidence and it's not a collateral. In 179 days before today, 203 hospitals were attacked and damaged. If you look at the so-called first phase of war, when Russians were actively advancing with a target to seize Kyiv and other major cities, the intensity of attacks were so high that 4 hospitals were attacked every day in Ukraine. But if you look even further into this period and look at the 3 weeks in March 21, before March 21, you will see that 5 to 6 hospitals were attacked every single day. And I'm speaking about direct and deliberate attacks. And this leads me to the conclusion that it was not just, bad luck. And that this phrase was told us as a testimony from one of the residents of Makariv near Kyiv when we asked local people, why do you think they did it to you? And they said this. that they can explain that, and they think it was a terror. And what was the main result of that terror? The main result, the main impact was not even that hospitals were destroyed and people didn't have a place to get care, or that patient pathways were disrupted or whatever. I would argue, I would claim that the main consequence of that terror was the all-pervasive huge insecurity which people felt. And I also believe that creating this insecurity was an intentional aim of the Russian forces, because that insecurity created something which Russians really succeeded at. They didn't succeed militarily, but they succeeded at creating the humanitarian catastrophe with their brutal tactics. And as of now, even now, as a lot of people would get back to the country and it's more or less safe in many places in the country, it is more than 6 million of refugees still remaining abroad, and another 6.6 million of people are displaced internally. Ukraine has a population about 40 million. This is a huge numbers of people who left the country because of insecurity. It means that 1 in 3 Ukrainians left their homes because of war, including myself, including Nataliia and her family. And it means that 2/3 of Ukrainian children left their homes, including Natalia's 2 children and my own kid. If you look at the losses which it had to it created to the human capital of my country, you can see that 16% of the population are outside of Ukraine right now. They're not in the country. If you took in terms of labor force, it's 20% of labor force. You can compare it with the Great Depression in the US in 1920s and 1930s. You can compare it to the 2008 unemployment in the Southern Europe. But with the one distinction, that this labor force cannot be just employed. Those people are outside the country. They cannot be employed in Ukraine. And the most appalling to me is 27% of kids are outside of the country right now. So this is the main impact, I would argue, to Ukraine. Moreover, we have territories in Ukraine which have quite a good chance to be totally depopulated. If you look at the ratio of IDPs who left some territories in Ukraine vis-a-vis those who are staying there, right? You can see that in the eastern part of Ukraine, as of now, 4 million left, only 1.9 remain there. That means that this area is almost depopulated and it has all the chances to be totally depopulated. So those are the challenges which Ukraine will face and which our country will need to be resilient against now and in the future. And I claim that the main fight our country will have, I tell you that we had enough problems internally before the war, but now the main fight will be for human capital and against insecurity, external and internal. I told you a lot about external insecurity, but we also had the internal one. As Nataliia said, before the reform, we had a lot of problems without Russia's war. 1 in 6 families experienced financial catastrophe because of health. 1 in 2 euro in health system were spent out of pocket, which is very, very high. 9 in 10 Ukrainians were afraid to fall into financial catastrophe because of health. And the health reform which started tackled those problems, right? And it was more than enough, believe me, to tackle, except for the war. So now the last thing to say is that we now have, at least I have it in my head, more or less a clear strategy, clear plan for the post-war Ukraine. The point number 1 in this plan is very simple. Russia must be defeated, because without defeat of Russia, there will be no post-war Ukraine, and there will be no post-war reconstruction. It is very important to understand for our European allies and you, just normal people in Europe, because you influence your government and your public opinion. If Russia is not defeated, there will be no reconstruction in Ukraine at all. Ukraine will turn into a place of suffering for years, and that's not what we deserve and not what we want. And the second, people talk about so-called Marshall Plan, investment into Ukraine. I hope it will come, but I claim that investment should be made not into the buildings in the first place, but primarily into people, into health services, into pharmaceuticals. And if you're talking about infrastructure, it should be redesigned and modernization of it, not just rebuilding of those Soviet, style buildings, which we had a lot. National health service must evolve into the very powerful social security system like the NHS in the UK after the World War II. It inspires me a lot, the story about the NHS in the World War II. And also we will need, of course, to attract our medical professionals inside. So again, the main message I want to deliver to you is that healthcare became a means of warfare in Ukraine, and it led to the mass loss of human capital, which we will need to reconstruct in the first place when this war ends. So now I pass the floor to moderator Beck. Thank you for your attention.
It's very hard to follow on from something like that, but I've been working with Pavlo and Nataliia for a few years now, supporting them in reforms in Ukraine. And in case you didn't know where I work and what we do, the European Observatory on Health Systems and Policies is a partnership between different national governments and international agencies such as WHO Europe, the European Commission, and we bring together different policy perspectives to identify what health systems and policies evidence Europe's decision makers need. So the observatory generates and shares the evidence in print, in person and online, acting as a knowledge broker, bridging the gap between academia and practice. And what I want to talk about today are three bodies of evidence. I want to talk a little bit about resilience, and I want to talk about health system financing for conflict-affected situations. And I want to also look at not just building back better, but building forward smarter. Okay, so resilience. In the observatory, we have already done quite a lot of work on resilience, which has been largely informed by the experience of all different health systems in Europe and how they responded both to the pandemic, but also to the global financial crisis in 2008. So when we're talking about resilience, what we're talking about is the health system's ability to prepare for and manage, so that is absorb, adapt and transform, and to learn from disturbances such as these external shocks. And by looking at health systems responses in Europe through the pandemic, one of the things that really became very clear is that flexibility is one of the things that is absolutely central to resilience. So, for example, we looked at how hospitals coped with sudden surges in demand and the need to continue providing routine services alongside care for patients with COVID-19 in order to limit unmet need for essential care. Now, various strategies were employed, but to cope with surges in demand, capacity was scaled up, repurposed and redistributed by increasing the number of intensive care beds, so using operating rooms and other facilities within the hospital as ICU, creating new spaces for care and recovery, tapping resources from other sectors, particularly the private sector, so using contracting models to contract in services from outside the statutory system, moving equipment and even patients, predominantly within countries, but also across borders. And service delivery was also transformed to try and cope with the extra demand on services while maintaining routine care by implementing alternative and flexible patient care pathways, recognizing the key role of primary care in the pandemic, in creating guidelines for treatment and prioritization, and scaling up the use of digital health. Now, this links in nicely with some of the things that Natasha was saying about using crises. But the panic really did spark a rapid scaling up of digital technologies right across Europe that supported the provision of health services. So I'm talking about things like telehealth services, e-prescriptions, and remote consultations. Now, these are things that in some countries, I mean, we all think of Estonia when we think about digital technologies, but in some countries, these have been well established for a number of years. But in other countries, they've been talked about forever, but they weren't possible to implement. But suddenly, under the pressure of the pandemic, it was possible, and they were implemented incredibly quickly. Crises open windows of opportunity for reform. Now, we have heard how the reforms to health financing strengthened the resilience of the Ukrainian health system as it increased the flexibility in delivery and financing during the pandemic, but also the war. However, the scale of destruction of basic healthcare infrastructure means that we also need to look at evidence around healthcare financing for conflict-affected settings. A key challenge here is balancing the humanitarian needs of a conflict-affected population with the needs for development work to strengthen the health system as we look to the future, and the importance of aligning these aims to strengthen the system as a whole. Now, what do we know about health system financing for conflict-affected settings? Well, there's actually a lot of evidence that's already been synthesized brilliantly by my WHO colleagues. However, these fragile and conflict-affected situations are diverse, and some of the lessons are potentially more relevant than others to the situation in Ukraine. But these are the points, when I was going through this literature, these are the points that really stood out for me when considering the Ukrainian situation. Firstly, we need to think about resource constraint. Wars are costly, and the full-scale invasion by Russia has put a huge strain on the Ukrainian economy. Resource constraint often means governments cut health spending, as happened in many countries during the global financial crisis. And this is something we really need to guard against. Reforms to centralised procurement and purchasing of healthcare services will hopefully help here to show the system offers value for money. But some mechanisms may need to be rethought, such as the use of capitation payments in the face of wholesale population displacement. If nothing else, it is really important that healthcare workers continue to get paid. The health workforce is indeed the key resource in the health system and will be central to all post-war rebuilding and renewal. We also need to be guided by UHC, and I don't mean the centre necessarily where Pavlo and Nataliia work, but by universal health coverage. So reforms since 2014 have been very much about strengthening financial protection and moving towards universal health coverage in Ukraine. And this needs to continue. With financial crises and resource constraint, there can be a temptation to introduce user fees to fill the gap. But conflict-affected populations are in no financial position to pay such fees and are at greater risk of being pushed into poverty. Another thing we need to be wary of is avoiding fragmentation. It can be really tempting at a time of crisis to put in place vertical programs to address particular problems or to extend services to particularly vulnerable groups. In a humanitarian crisis, this is sometimes necessary. However, there needs to be a plan for how these services may be drawn into the existing system, or services provided through the existing system. These services can be provided through the existing system in order to avoid silos and duplication. It is also important for strengthening the capacity in existing health systems and not undermining it. And for this, coordination is key. Part of avoiding fragmentation and duplication in the health system is to ensure international and internal assistance is carefully coordinated. Ideally, everyone is, as the saying goes, singing from the same song sheet. That means they're following the same broad vision for how the health system should be organised and financed post-war, so all efforts are in line with this future vision. Ukraine deserves a Marshall Plan for post-war reconstruction, but we do not know when this will be. Conflicts can freeze and unfreeze. Wars can be over by Christmas, or they can last decades. We therefore cannot wait until the war is over. Laying the groundwork for reconstruction can happen now. And while lots of funds may flow into Ukraine for post-war reconstruction, these need to be spent rationally to maximise their impact and ensure sustainability. Because while money for capital projects should be forthcoming, routine spending will still need to come from the national budget, which leads us to the focus on sustainability. The health system needs to be flexible to ensure resilience, but it also needs to be sustainable. And this needs to center efficiency. And in the Ukrainian context, I would argue, especially energy efficiency. Sustainability means rational planning for hospitals and high-tech equipment, but building back better means building back greener for financial sustainability, but also for security reasons. Once again, coordinating the flow of external and internal donor funds will be crucial for ensuring that services and infrastructure put in place can be sustained over the longer post-war timeline. So in Ukraine, we're not building back better, we are building forward smarter. And to do this, we need a plan. We need a plan that ticks all these boxes, a plan that makes the case for investing in health as the foundation for a strong economy, a plan that aligns the EU accession requirements, a plan a plan for a resilient health system that is flexible, efficient, sustainable, and equitable, a vision for a patient-centered health system that invests in the well-being of the Ukrainian people, a transparent system that is accountable to the taxpayers who fund it. The big challenge would normally be getting broad support for such a long-term vision, especially in Ukraine, where party politics and the electoral cycle actually mean something. But crises present windows of opportunity for people to come together around a common vision. A health strategy to 2030 has been drafted and is being discussed currently. And this is the opportunity for Ukraine to not just consolidate reforms so far, but to leap forward with a renewed, not simply rebuilt, health system. So why would such a plan matter? And why is political buy-in so important? Well, it's important for keeping momentum because of backsliding. Progress in health system reform is not inevitable. Priorities change. And this, in a way, is the essential nature of democracy. But hopefully, if we can all agree on the big things, we can move forward together. So thank you very much for your time. Please do visit the Observatory webpage, where there are lots and lots of very, very exciting resources and evidence syntheses for you to enjoy, and of course the webinar series. So thank you.